right? How do we deal with managing acute injuries versus chronic injuries? Is there some way of thinking of this? And then also, again, as I said, it's kind of a two-part question. Are we just taking time off? Is that what we should do? Should we just be like, right, I'm injured in whatever way, shape, or form. Do I just do nothing now? Right? Is that going to be the protocol? Or are we, modifying like we've been discussing and doing something and getting some movement through the body?
Yeah, so with an acute injury, like let's say within the last week, there was a specific event that led to the onset of pain, and it's very clear that you can identify, what caused it, when it onset, etc. There's kind of a fairly simple rule of thumb that you can start to follow, or simple plan of action. And that would be initially, you definitely want to reduce your exposure. Okay. So, like, let's say you just hurt your shoulder at the bottom of the bench press. When it happened, you've got maybe 5, 6 out of 10 pain at the moment. It's aggravated by activity. Very simple there. You're going to apply all the parameters I discussed previously with regards to like modifying your volume and all the other training parameters. You're going to see how your symptoms modify, so that if they improve within a week, you again start building up again nice and slowly. But that threshold is going to depend on how severe the injury was. Obviously, if you tore your pec or something, like, you're not going to be modifying your training yourself. Like, you should be seeing a professional for that. But ultimately, that acute injury process, you're going to reduce the exposure and gradually try to build up and see how that goes. It mightn't always be very smooth, but typically I think your expectation there is going to be pretty positive. Like, if you tweak something in the gym and you've got pain, you pull back, you see how the symptoms change, and you begin to rebuild over the course of a number of weeks. And it's a pretty simple process like that. Whereas with chronic injuries, things that are there more long term, they require a bit more nursing, in that, like, I've got right knee pain, and it's the side that I would, like, if you're familiar with jiu-jitsu, it's the side that I would kind of pass on in jiu-jitsu and do like a cut knee through pass. It means that, like, this knee is constantly exposed to torquing forces over and over again. Okay, it's my dominant side. If I'm kicking a ball, that's going to be exposed to those forces. I'm obviously training it in the gym and everything, but that knee is at me and has been at me for a while. I don't really expect there to be anything that I can do that's going to improve it really quickly. Like, I know that long term, it's a case of me modifying the loading that I expose it to. So, for example, in sport, I'll just say sport rather than jujitsu. In sport, I want to avoid the positions that aggravate it the most. In the gym, I want to obviously aggravate or avoid the positions that aggravate it the most, modify my exercise in accordance with the principles that I discussed previously, and continue to train as hard as I can while minimizing the symptoms that I'm experiencing. If I can continue to not aggravate it, I will see an improvement in my symptoms. I know that. But I don't really expect to get to the point where I can continue going into those provocative positions without flaring up the symptoms in the way that I would if I'd never injured it in the first place. So I think that that's something that I will just deal with kind of longer term, on and off. But it's not anything major. It's just one of those things that's a niggly area for me, and everyone has those. And I think that one of the things I deal with most often in coaching is trying to explain to people that that's normal, because I think a lot of people have been sold the lie that, like, you can train hard and take your training really seriously, especially in some sort of sport, and just never experience pain or injury and just prevent all these things from happening. It's just not realistic, especially in more chaotic sports. But you're going to have areas that will flare up every now and then. It doesn't mean that, that's something that needs to always be fixed immediately. Sometimes you're going to have symptoms and it's okay. So for me, it's my right knee. Sometimes it's my left knee, and I have different areas of my body that will creak and groan at me every now and then if I push my training a bit too hard. So for me, that's a longer term management strategy where I'm keeping all of those variables in check. I'm really paying attention to when I flare it up a bit more. So for example, I had a jiu-jitsu session a few weeks ago where there was an acute position that like someone switched their hips, and suddenly I felt a real sharp pain onset in the knee immediately, and I was like, I'm after flaring that up now again. I need to be careful over the next few sessions. So I was just more careful. I pulled back my training in the gym loads because I knew that this was a bit of a flare up, and that would improve again within a few weeks. So long term, you're thinking about that nursing strategy. You're not setting yourself the goal of like being pain free in a week, but you're thinking more maturely about the long term of what you can do to modify it. Now, that doesn't mean that you should accept long term pain, because very often like things can improve. Like if you've got some sort of tendon injury, or you've got a recurrent muscle strain or something like that, you can absolutely engage in specific rehab practices. But when it's something maybe that's more, let's say, deeper in the joint, maybe it's a bit of a meniscal issue, but it's not really warranting surgery, or there's nothing that's immediately fixable, then you might have to deal with those symptoms longer term. Same if you've got like arthritic changes, like some degree of arthritis in your joints, which again is normal with age. There's not necessarily a quick fix for that, but you're modifying training in accordance with that. So I think the most important thing is having realistic expectations, and understanding that if you've had symptoms in an area for 3 years, like, you don't expect it to be gone in 3 weeks. That's just not realistic. You could certainly work towards it over a few months. Maybe it's that you've actually got clear things that have led to this. Like if you've got big programming red flags where you're in the red on all those variables that we touched on previously, you've got poor technique, you're doing excessive volume, you've got no programming strategy, you never take time off, then you're far more likely to be able to get rid of this injury and not have to deal with it in future than the person who's been doing everything super diligently but still has pain.